You're watching Amador County's local television network, TSPN. And now, TSPN News with Tom Slavik. Comprehensive news because in today's world, you need more than just sound bites. TSPN, streaming on the World Wide Web, and now on demand at TSPNTV.com. Hi everyone, Tom Slavik, and welcome to TSPN TV's News in Depth for this weekend. And I'm with Dr. Arnold Zeiderman. How you doing, Doc?
Hey.
Haven't seen you in a while, but I used to see you all the time.
Yeah, well, I'm laying low.
Laying low, okay, all right. Do you still have a practice here in Amador County?
No more practice in Amador County.
Okay.
Not as an OBGYN.
Okay, so you have a practice, are you practicing still?
Well, sometimes I go out of the country and do surgery on people in the third world, and that won't be until January. But right now I've been really involved in the mental health services.
Well, good, because you've always been very involved here in Amador County. You were on school board.
Right.
You had a great practice, school board, and then after that you were with the GOPE
Still am.
And you still are as well?
Still the chairman, yeah.
Okay, still the chairman?
Yeah, we had our congressman was here in town
I have to bend your ear after the show. Anyway, okay, Doc, it's really glad that you're here, and we're going to talk about something that I know Sue gave you a call, said, why don't we come in and talk a little bit more, and that's because she found a news release where the Amador County Behavioral Health Advisory Board seeking new members, right?
Yeah, actually,
and so you put this out. So why don't we talk a little bit about this part?
I sent her that release at the request of the chairman because we have a Amador County Behavioral Health Advisory Board in our county, as there is one in every county mandated by law. And we were trying to get more done and wanted to get some new members because there's been some attrition over the years. So we're trying to attract people, and in fact, we had 4 people show up at the meeting 2 days ago. A nurse, a doctor, a lady that works in one of the community services, and a gentleman that just wants to be there because he's got some people in the family that he wants to be able to. Okay.
Now, I read this, and if I understood it right, you just need to be a resident of Amador County to be able to be on that board, or a professional that helps people in another county.
Well, the committee can have up to 15 members.
Okay.
It actually could have more if the Board of Supervisors wanted to. And if you're a small county, you have to have a minimum of 5. So we're somewhere in between. I think right now we have about 7 or 8, and we're going to add maybe 3 or 4. So theoretically, there will be more room, and if anyone is interested, they can apply. The qualifications are basically that you live in the county. There is a rare exception for health providers that live out of the county and work here. But basically people that live here, and half of the people on the committee need to have either themselves or someone in their family having had to access mental health services or have an ongoing issue. So that leaves half of the people that could be there because they're just interested, or because they're in the health profession, or they have a background in psychology or something like that. So, but the bottom line is, yes, if the people are interested, they should contact me, and we ought to leave my email maybe at the end.
Okay, great. Okay. Now, Doctor, what is that board charged with doing? What is it? What is it to accomplish?
Well, basically, the purpose of the board is to be a forum where issues can be brought forth, and to develop an awareness of the needs, basically to determine what are our needs in the community. It's supposed to be really an independent board of advocacy to determine what the needs of the community are and see that that gets conveyed to the Board of Supervisors through the person who is the supervisor that sits on the committee. In this case, it's Lynn Morgan, and that person would bring it back to the Board of Supervisors, so the Board of Supervisors would have an independent source of information in regard to how issues are being addressed in the community, how resources are being expended, how the agencies are doing their job, and that's what we do.
This is a result of I believe it was What is it that we put on the ballot?
We got to go back to 2004.
Okay.
And there was something called, I'll take you through it quickly if I can, because it's complicated. It was something called Prop 63.
Okay.
And that was voted on and was going to be a tax on millionaires of 1% a year, which, believe it or not, generates about $1 billion a year. So there's been $13 billion. It was manifested as the Mental Health Services Act. So Prop 63 became the Mental Health Services Act, and then that was revised in 2013, and there have been a couple of amendments through laws to kind of make sure that it works as effectively as we would like, particularly that the money gets spent properly, oversight. So that's the background, and there's it provides about 25% of the money for mental health services in the state come through the Mental Health Services Act. So some of that money comes to our county. I don't know what the percentage here is of our overall budgets, but it's certainly significant. And finally, so you understand the reason this came about was that in the 60s and 70s, we developed the ability to treat people with medications so they didn't have to be confined to these large mental hospitals that existed. Like when I was a medical student, I worked in one. And as they began to close the mental health hospitals, they wanted to see that funds went to the community so services could be provided. We know now that that hasn't worked out all so great because we have a lot of homeless people and we have people in the jails. 20% of the people in the jails are mentally ill. So, you know, the people that aren't getting in the hospitals, they're still around that 8% of the population. 8% of the adult population and 5 to 9% of children have serious mental illnesses. Just get that. 5 to 7% of adults and 5 to 9% of children have serious mental illnesses. That means right now there are about 2 million people in California that have serious mental illnesses.
How many? That's a good statistic. Do we know how many people are getting help at this time out of those 2 million?
Well, we know a lot of them aren't because a lot of them can't access it. They can't get to see perhaps a psychiatrist for treatment, diagnosis, and treatment. And of course, early diagnosis is terribly important because if people aren't treated, it just destroys their families and their lives. And when it's untreated, it gets worse, and that causes disability. It causes suicide, incarceration, homelessness. As I said, 20% of our prison population are mentally ill. They say that the biggest mental health hospital in California is the prison in Los Angeles. So we have a real tough problem in our hands.
I want to maybe ask you a tough question, but are there degrees of mental illness?
Oh, absolutely.
Okay.
Yeah.
So.
Yeah, there are some people that are, they're anxious, they're moody, or they don't sleep well. But then, it gets worse, and then you move into what we call the psychoses, where people begin to get out of touch with reality, where they hallucinate, or they have bad thoughts, or self-destructive thoughts, or violent thoughts. Yeah, so that's what we call the psychoses. And those are really serious problems because that's not the kind of thing you can just sit down and counsel somebody about. They really basically need an intervention. So it's like if you're a diabetic and your blood sugar's out of control, you don't go to the doctor's office to just talk about it. You need insulin. So these people need medication. Those are the ones with the severe mental illness. People that have the less severe ones that sort of get by, And that's very pervasive. That's very common. Lots of people experience disturbances of their mood in a given year.
I'm going to ask another question. With the passage of Obamacare, ACA, are people helped through that program? Just to go to a hospital, say,
Well, actually, it depends. It depends through most of the county services that are provided, including this county. The only service they really can bill for is Medi-Cal. So if you don't have Medi-Cal, you really can't get services through the county. You can't get Medicare, and if you're on Obamacare and you've gone, that doesn't really mean that you can get it. So the answer is no. Obamacare doesn't really fix the problem. Okay? And then even if they do go to get it, then they go out and they say, well, let me find someone in the community because I went over to the county and they don't take my private insurance. And then you go out and you try to find a psychiatrist, and we don't have one practicing in this county.
Okay, so it sounds, first of all, you've kind of described something that, mental illness that a person might have, or just anxieties at the time, or whatever, but not knowing how to get help. Is the board, is that someone that a person contacts to get help? How do people get referred there? Are they self-refer?
Well, people that live in this county, they can communicate with the behavioral health services through HHS. It's online in the phone book, and see if you can be seen if you're eligible, and I would definitely suggest that people do that.
Do family members do that as well? Can they intervene, or do they have to?
There's a broad
have to bring the problem forward themselves.
No, adults can bring in their young children under 18, but there's a broad spectrum of services available for mental health here, whether it's substance abuse or alcohol or depression. There's a whole host of services available, and people should avail themselves of that. So they should communicate, look through the behavioral health services if you want to be seen. And hopefully, though, they can get some services there.
Okay, we have just about 20 seconds left, so I guess we're going to come back. We're going to talk a little bit more about the issues and what the board is doing.
Right.
All right?
Great.
Okay, stay with us. We'll be right back. After this break, I'm with Dr. Zeiderman, and stay with us right here on TSPN.